Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Aina Rifah and I will start this video with the introduction of sinusitis infection. Sinusitis is a swelling or inflammation of the sinus tissue. The sinuses are four packed cavities in the skull. They are linked together by a narrow channels. The sinuses produce thin mucus that drains through the nasal passage. This drainage aids in keeping the nose clean and bacteria-free. The sinuses, which are normally filled with air, can become blocked and filled with fluid. Bacteria can grow in this environment and can cause infection. Bacterial sinusitis. Okay, there are two major types of sinusitis, which are first, acute sinusitis, which is a short-term inflammation. This term refers to a sudden onset of cold symptoms such as runny nose, stuffy nose, and facial pain that does not go away after 10 days. And worse, initial symptoms termed double sickening. It responds well to antibiotics and decongestants. Acute sinusitis usually lasts for less than a month. Symptoms may go away on their own after about 10 days, or it could take up 3 to 4 weeks. The second is chronic sinusitis, which is characterized by a long-term sinus inflammation, swelling, and infection. This term refers to a condition defined by nasal congestion, drainage, facial pain, pressure, and decreased sense of smell. It can linger for a long time and usually more than 12 weeks. Chronic sinusitis may require a variety of treatment. Surgery may be required in severe cases of chronic sinusitis that does not respond to other treatments. The paranasal sinuses are located in your head, near your nose and your eyes. They are named after the bones that provide their structure. Okay, first, the ethmoidal sinuses are located between your eyes. The maxillary sinuses are located below your eyes. The sphenoidal sinuses are located behind your eyes. The frontal sinuses are located above your eyes. Right now, we're going to talk about the symptoms. Common signs and symptoms of sinusitis include postnasal drip, mucus drip down the throat, nasal discharge, thick yellow or green discharge from nose or stuffy nose, facial pressure practically around the nose, the eyes and the forehead, headache or pain in your teeth or ears, halitosis, which is bad breath. You cough, you feel tired, fever, and usually the sign of symptoms of chronic sinusitis and acute sinusitis are similar. Okay, right now we're going to talk about treatment for sinusitis. If you have a short-term sinusitis, decongestant, nasal saline, drinking fluid, or some of it. For home remedies, apply warm compress on the face or use steamer or vaporizer. Medicine, aspirin, desensitization treatment, allergy medication, saline nasal irrigation. Long-term sinusitis, you may need to have surgery, immunotherapy, oral or injected with corticosteroid. That's all from me. Thank you.
Assalamualaikum, my name is Faradim and I'm going to explain about the problem statement of this assignment. The problem statement of this study is that we want to clarify the problem of sinusitis and how it can affect the human daily life. Our group chose sinusitis as the disease that we want to explore more is because sinusitis is a common disease among the population in our country. Someone with this disease must have their own level of ability to fight with this disease because it is not easy to hold out if the disease is very severe. Sinusitis can also affect a person's quality of life and can cause discomfort to the person in his or her daily life. Aside from that, questionnaires have been gathered for this study and it will be used to determine how sinusitis occurs in the society and some variables that contribute to this issue.
Assalamualaikum dan selamat sejahtera. My name is Muhammad Hakimi. Let's take a look about this objective. First, to investigate more about sinus disease. Second, to find cause of sinus disease in respondent. For example, feedback is distributed through the medium of Google Form. So, this step can identify the causes of often contagious disease in the community. Bacterial sinusitis and chronic sinusitis is the example of sinus disease.
The next part is methodology. There are two ways that has been done to ease the study. One of them is by conducting an online survey that has been done by Google Form. This platform is an easy and interactive way for the respondents to answer the survey. Also, the next method used is by personal interview, which is done by the WhatsApp platform by our other group members. By doing that, we have collected key information regarding the patient. We also have collected their age, sinus history, the causes of sinus, to the symptoms that they have gone through. Most patients have endured different symptoms than the others that will help with this study. Also, we gathered information whether the patient is smoking or not and their choice of lifestyle. Their choice of lifestyle varies from drinking alcohol to the diet they take. And lastly, the treatment they received, from differentiating from light sinusitis to a more acute condition. All of this is essential to help on completing our study. Thank you.
Assalamualaikum. I'm going to talk about the result that we get from the online survey carried out through the Google form. First, many of our respondents are aged less than 20 years old, while only 32% aged 21 to 50 years old. Our respondent consists of 67% female and 32% males. Our next question was, we asked if the respondent experienced any stuffiness or pain and swelling around the eyes. The results state that 67% of them answered yes and 32% answered no. Then our next question is, when the respondent had their sinus infection, 58% answered yes, answered 5 years ago, and 12% answered 1 year ago. And our next question is, do you smoke? The results show that 87% of them did not smoke, 9% smoke, and 3% has stopped. The next question is, do you have asthma? And the result is 83% said no and 60% said yes. Next, the respondent was asked if the cause of their sinus infection, and 50 people answered common cold, and 40 people answered seasonal allergies, 3 people answered deviated septum, and 8 people answered because of the weak immune system. Our next question is about if they have allergies, and the result shows that 70 people do not have any allergies, and 30 people state yes, and the majority of the allergies are dust, animals fur, and seafood. Next, the respondent was asked the condition of their smell sense, with 58% answered good smell sense, 32% with moderate, and 9% with bad smell sense. The next question is how much the respondent has treated their sinus infection in the last month. The results are 54% of them had 0 times, 90% with 1 times, and 10% with 2 times. And then the respondent was asked their type of sinus disease. 12 answered ethmoidal sinus, 12 maxillary sinus, 7 sphenoidal sinus, 5 frontal sinus, and 3 people don't know their type. Next, we asked what the respondent did to relieve their sinus symptom. 38% answered rest, 38% answered by taking medicine, and 90% answered by going to the clinic. And the next question to the respondent is, what is the medication that they take? Antihistamine with 11 response, decongestant with 70 response, and nasal spray with 7 response, and leukotriene blockers with 4 response. That's all from me, thank you.
Next, the discussion. As mentioned before, there are 4 types of sinusitis. Based on the result, majority of the respondents are affected by ethmoidal sinuses that are located between the eyes and maxillary sinuses that are located below the eyes. This is because maxillary sinus is the largest of the paranasal sinuses and the symptoms are headache, nasal obstruction, post-nasal drip, and can even have a fever. Ethmoidal sinus is the inflammation of a specific group of sinus which located between the eyes. The ethmoid sinuses are hollow space in the bones around the nose. They usually have mucus to help prevent the nose from drying out. The symptoms of ethmoid sinus are including facial swelling, runny nose for a period of time, headaches, and post-nasal drip, which is mucus moves down the back of the throat. Moreover, the respondents who are seen to be infected by sinusitis are mostly ages 18 and above. This is due to the fact that as we age, our nasal lining thins, making us more susceptible to sinus infection. Furthermore, the main causes of sinus among the respondents are mostly common cold, nasal and seasonal allergies, and weak immune system. Colds can lead to sinus when the sinus swell up. Air, mucus, and bacteria can become trapped in the swollen sinus and can cause further infection. People that have weak immune system are more likely to have allergies and can develop sinus infection when the nasal passage get infected by bacteria. The treatments that are involved in this disease are usually or commonly decongestants, antihistamine, and nasal spray. Decongestants and nasal spray can help to lower the amount of mucus in the sinus. Meanwhile, antihistamine helps to relieve the symptoms of nasal allergies. Regarding the survey, questions like smoking, having asthma, and hereditary disease were asked to the respondents because these matters can contribute to a person being infected by sinusitis. Smoking can cause the airway of the nose to irritate, gases from the smoking can cause the cilia to be damaged, and the mucus will back up in the sinus and bacteria will start to multiply. Having asthma can also have long-term problems of the nose, and by having someone that has been infected from the family can also contribute to the infection of the disease. As a result, a person should constantly remember to look after his health by avoiding activities that might cause disease or infection, such as sinusitis. Drinking enough water on a regular basis, avoiding a dry environment, and sleeping with your head high are all good strategies to avoid sinusitis because when your head is low at night, mucus will accumulate in your sinus. That's all for the discussion. Thank you.
In conclusion, as precaution, we need to prepare ourselves with healthy practices, for example, healthy food and always be in a clean environment.